the Committee on Oversight and Government Reform, the Subcommittee on Government Operations, and the Committee on Veterans Affairs Subcommittee on Economic Opportunity will come to order, and without objection, the Chair is authorized to declare a recess at any time. Good afternoon, and today's hearing will allow us the opportunity to learn more about the official time use at the Department of Veterans Affairs. And for those of you who may not know what official time is, what a federal employee actually does to use official time and representational work on behalf of labor unions during work hours, even if that work is unrelated to their regular assigned duties. The official time statute broadly lays out those union activities that are reasonable, necessary, and in the public interest that are permissible. And the last time OPM disclosed data on official time use in 2012, it revealed that VA employees comprised almost 1/3 of the 3.4 million hours of official time performed by federal employees government-wide. Specifically, VA employees performed 1,086,257 hours of official time, and that's the most of any agency. OPM also found that official time is on the rise, increasing by 500,000 hours between 2008 and 2012. Between fiscal year 2014 and fiscal year 2015, 1,942 VA employees were engaged in some degree of official time. And in fact, in fiscal year 2014, 345 VA employees had 100% of their time was official time. So they were essentially full-time on official time. That means that 345 VA employees spent all of their time engaged on union activities. In fiscal year 2015, that was 343 VA employees that had 100% of their time engaged in official time activities. Data provided by the VA to the committee reveals that 3 of the top 5 positions with full or 100% official times were nurses. The data we have is only a small window into how much time federal employees spend on official time activities, but because agencies are not required by law to annually report the amount of time their employees perform, it makes it very difficult. Making the recent audit of the VA done by GAO, it found that it could not accurately track the amount of time employees spend on official time at the VA agency-wide, with the VA taking up 1/3 of the official time for the entire federal government. It's important that it employs accurate methods to calculate and records to show how much time we're spending on those union activities. Now, I look forward to hearing from both the GAO and the VA to see what steps can be taken to make sure that not only we accurately reflect that, but what steps have been taken and can be taken to accurately track official time. I want to be clear about one thing. This is not about whether federal employees should or should not participate in official time. I recognize the importance of that particular activity. Today's hearing is really about what is reasonable and what is in the best interest of the taxpayers who foot the bill for official time. With the VA backlog in the tens of thousands, it's reasonable for medical professionals. Is it reasonable for medical professionals to spend 100% of their days on VA union activities? And so with that, we continue to hear of VA understaffed situations in the midst of an access crisis. Is it responsible for doctors, nurses, and other employees providing direct patient care to be 100% official time, or maybe even 75 or 50%? Our nation's veterans deserve to have an accountable VA. Understanding how much time VA employees are spending on union activities is an important part towards granting the veterans the access to proper care they deserve, need, and have earned. And so with that, I now recognize the ranking member of the Subcommittee on Government Operations, my good friend from Virginia, Mr. Conley.
Thank you. Thank you so much, Mr. Meadows, and thanks for holding this hearing on the use of official time and the ability of unions to protect the whistleblowers who help prevent waste, fraud, and abuse in the federal government. Our committees have a longstanding commitment to whistleblowers. But sometimes I think some of my colleagues forget that whistleblowers are federal employees. Attacks on federal employees can do harm to whistleblowers. That may suit our new president, who's already muzzled whistleblowers temporarily at some agencies, but I feel it's detrimental to the positive influence whistleblowers have on federal operations. For this reason, I joined Chairman of this subcommittee in sending a letter to all agencies to determine the effects of gag orders on whistleblower protections. And I thank the Chairman for joining with me in that effort. Today we received a letter from a whistleblower, a federal employee at the VA, the very agency the Chairman was just talking about. Her name is Dr. Michelle Washington. In 2011, Dr. Washington was a psychologist and coordinator of post-traumatic stress disorder services for the Veterans Affairs facility in Wilmington, Delaware. She observed that veterans were facing severe problems getting access to mental health services. She subsequently testified before the Senate Committee on Veterans Affairs to voice her professional concerns with the system not fulfilling its mission. Did she get a bonus or a promotion for a job well done? Far from it. Her supervisors at the VA retaliated. Her excellent performance evaluations suddenly became downgraded. She was relieved of responsibilities helping veterans and was uninvited to planning meetings, and her coworkers were pressured not to associate with her. This is a video of Dr. Michelle.
Psychologist Michelle Washington says that in 2011, the Wilmington, Delaware Veterans Hospital was overwhelmed by the number of troops returning from war with PTSD.
There was a massive delay in the treatment. Often what happens, they start self-medicating with drugs or alcohol, and they don't come back. And they end up getting lost in the system and lost out there in the world without the help.
Here at the VA hospital where she works, Washington says her concerns were ignored by supervisors, so she accepted an invitation to appear before the Senate Veterans Affairs Committee. But after she requested time off to testify, she received the first and only unsatisfactory performance rating of her 5-year career at the VA.
I remember going to my office and almost on the verge of tears. I had to really kind of grasp, pull myself together because I had a patient waiting for me.
We reviewed each of Washington's performance ratings. She was rated outstanding on all of them except this one. It reads, she does not use her supervisory channels to address issues with the PTSD programs.
Were you afraid that you might lose your job?
I was really worried about what might happen. Thank you for the opportunity to testify.
Risking her career, Washington, whose father was a Navy veteran, spoke her mind.
Too often, I am told that the patient will have to wait as long as 6 weeks for the first appointment.
After the hearing, she says the retaliation continued when she was stripped of her core duties screening new patients for PTSD and traumatic brain injury.
Thank you. The retaliatory actions taken against Dr. Washington were illegal. Last week, the Oversight Committee strengthened these protections when it unanimously passed a bill I co-introduced with Representative Duffy, H.R. 657, the Follow the Rules Act, also co-sponsored by yourself, Mr. Chairman. It's not enough to pass these laws, however, and pay lip service at occasional hearings. These protections have to be enforced. In the workplace, federal employee unions enforce the whistleblower laws Congress passes, and they do it on official time. Current law allows unions to stand up for federal employees facing retaliation such as Dr. Washington faced in the workplace. Dr. Washington's letter states that official time is, quote, absolutely necessary to help protect veterans, workers, and whistleblowers. And I would ask unanimous consent to enter her letter addressed to you, myself, Mr. Chaffetz, Mr. Cummings, into the record.
Without objection.
I thank my friend. Dr. Washington explained that AFGE representatives were only able to help me at designated periods of time when they were allowed to use official time. My union representative used official time to research OPM regulations, as well as write up and file the grievances and attend meetings with me in attempts to address the retaliation. And remember, the broader goal was in order to make sure veterans were served. Some of my colleagues want to eliminate the ability of federal employees to perform union representational duties in official time. Dr. Washington's experience tells us what the consequences of that policy could be. She wrote, quote, "If official time had not been available to the AFGE representatives, we may not have been able to defend my case. It would have set a precedent that management can retaliate without consequence." I'm certain we don't intend to disadvantage whistleblowers. I know we're committed to them. But the effect of their concerted attacks on unions and civil service protections sometimes would be to strip whistleblowers of their advocates in the workplace, their union. And I hope Mr. Chairman will proceed with great caution on this subject, and I thank you for holding the hearing. I yield back.
I thank the gentleman. The gentleman from Virginia knows very well that whistleblower protection and the rights of federal employees is something that may not normally be a bipartisan issue, but with this chairman certainly is, and I will continue to remain vigilant as we look to protect those.
And for the record, I know that, and I reaffirm that. You're absolutely right.
I thank the gentleman. The chair recognizes the chairman on the Subcommittee for Economic Opportunity of the Committee on Veterans Affairs, Mr. Arrington, for his opening statement.
Thank you, Mr. Chairman. I'd like to also reiterate that I support protections for whistleblowers, and I want to note that last year's Congress enacted one of the strongest whistleblower protection initiatives within the VA in our nation's history. So I think we stand shoulder to shoulder on that. Thank you, Mr. Chairman. Thanks to everybody for being here. Thank you, panelists. This is my first official hearing as chairman of the VA Committee Subcommittee on Economic Opportunity, and let me say I'm very excited to work with my ranking member and fellow Texan, Congressman O'Rourke. And I'm also pleased, obviously, to partner with you, Mr. Chairman, and the other members on your committee. I believe we can all agree that the mission of the Department of Veteran Affairs is to care for those who have borne the battle. This is more than a government agency mission. This is a sacred honor. This is a sacred responsibility for every VA employee and for every American. The men and women who have raised their right hand to serve and who've been willing to make the ultimate sacrifice, I think you will agree, deserve nothing but the best service and care worthy of their commitment to our country. Unfortunately, time and time again, situations have come to light where the care of our veterans, the care that they were receiving, didn't measure up to this standard of excellence. Now here we are, almost 3 years later, after the Phoenix and agency-wide waitlist scandal where several veterans waiting for months, some who died before they could get an appointment with a doctor. And yet the problem still persists. Veterans are still waiting too long to receive an appointment. Veterans and their families are still waiting too long for their disability compensation claims adjudicated and their appeals to be decided upon. 450,000 plus appeals in backlog. In fact, VA's own statistics indicate that there are over 45,000 vacancies within the Veterans Health Administration, and the claims backlog for disability claims has recently increased 33%. These statistics are absolutely unacceptable, and they are the reality, and in my opinion, the shameful reality of the current state of affairs at the VA. I want to be clear, the purpose of this hearing is not to completely discredit any use of the official time within VA or even across the federal government. After all, it is allowed under law. We must, however, ask ourselves this question: are we going to fulfill the mission of the VA and provide excellent service to our veterans, or are we going to perpetuate what I believe appears to be a broken bureaucracy and a culture of unaccountability? I'm grateful to the Government Accountability Office for taking this large task of looking at the use of official time in VA. at the VA and how the department is tracking its use as well as space at facilities used for union activities. I'm very troubled, Mr. Chairman, by their findings that the VA is not accurately or sufficiently tracking how much time employees are using official time, and that the data that we do have from the VA is unreliable at best. This concerns me on a number of levels. Are people taking advantage of the system? I would conclude that most likely they are, because whether intentional or not, without an accountability system, there's no consistent means to track official time, even if you wanted to. And as the old saying goes, if you can't manage what you can't measure. This issue brings me to something that concerns me even more. Not only are some individuals spending 100% of their working days doing union activities while receiving their taxpayer-funded salaries, but some individuals are receiving their taxpayer-funded salaries and are not even being appropriately tracked for what they are doing with the time that they are not directly serving our veterans or just doing the jobs that they were hired to do. As someone who has overseen multitudes of different staffs throughout my career, I can't fathom an instance where I would be paying someone a taxpayer-funded salary to do a job that I can't even account for at the end of the day. And what's even more troubling is that in the recent GAO report, this is not the first discovery. This is not the first time this has been brought to light. There have been other studies by GAO, 1979, 1981, 1996, recommending that time spent on union activities needs to be better tracked. Here we are again, 2017, still having the same conversation, and GAO is still making the same recommendations. This is insane. I understand both sides of the aisle aren't going to always agree on to what extent unions should be involved or the power that they should hold in the federal government, but I know that we all agree that the Department of Veterans Affairs should place the needs of our veterans above all else, and I'm very concerned that in this current environment, this isn't the case. We have doctors, nurses, medical assistants, therapists, pharmacists, claims raters, senior raters, and so on, serving on official time, many 100% of their official time. Some of them making over 6 figures. This means we have hundreds, if not thousands, of VA employees spending part and sometimes all of the working days serving the union instead of directly serving our veterans. Again, doing the job they were hired to do. I understand that union representation, that union representatives are supposed to serve the employees of the VA facility, whether it is through grievances or management relations, which in turn, one could argue, serves the overall facility's function. But you would be hard-pressed to convince me or any reasonable person that a physician making over $200,000 a year, paid for by taxpayers, is best utilized sitting in an office dealing with union grievances for 100% of their working day rather than standing by the bedside of a veteran, caring for that veteran. The standard for official time is to use it on, quote, representational work that is, quote, reasonable, necessary, and in the public's interest. I don't believe the average American would see this as reasonable. I don't believe the average American would see this as necessary. And I don't believe they would see it as in their interest. In fact, I believe the average American would be outraged. I came to Congress, as I think most of my colleagues did, to make a difference, to root out the real problems facing our country, find real solutions. And while this hearing today is not going to completely resolve all the issues related to official time and union activities on the taxpayer's dime, I think this discussion is necessary and pertinent, and we continue to reform and fix the VA as a whole. I thank the witnesses for being here. I look forward to your testimony. And thank you, Mr. Chairman. I yield back.
I thank the gentleman from Texas. The chair recognizes the gentleman from Texas, the ranking member, Mr. O'Rourke.
Mr. Chairman, I want to thank you and the ranking member of the Government Reform Subcommittee and my chairman of the Economic Opportunity Subcommittee of the Veterans Affairs Committee for putting this hearing together, to the witnesses who've made available to us and our government and the veterans that we serve their time and testimony, experience, and expertise today. Looking forward to learning from you. And Mr. Chairman, just briefly, I had on Friday the opportunity to visit the Veterans Affairs Medical Center in El Paso, Texas. There were, there was a full lobby, volunteers greeting veterans, veterans coming in for their appointments, veterans leaving, and the staff who served them. And it underscored how important our mission is here on these committees, the VA's mission to our veterans, and also showed some of what is working that we need to capitalize on. The veterans that I spoke to, and we know they're not shy about telling us when things are not working, to a person, if they had been seen by a doctor or provider, said that they had received excellent, timely care. The staff that I had a chance to meet, shake their hands, ask them how they were doing, upbeat, smiling, wanting to serve. But I'm also mindful of the fact that too many veterans in El Paso and every community in this country are unable to get an appointment, whether it's a mental health care, primary care, or specialty care appointment, or they're waiting too long on a claim to the Veterans Benefits Administration, or an appeal to that claim whose wait time is not measured in months, but today in years. So we have some problems. I want to ensure that whatever we do capitalizes on the strengths that we have and addresses those weaknesses and corrects them. And in both cases, that will be dependent on making the most of the employees that we have at the VA. They are the ones who in many cases are veterans themselves. In every case are represented by the unions at the VA. And I would argue are fundamental to the solutions that we're looking for. And we have some examples in this GAO report of where management and employees agree that but for the work of these unions, we would not be able to train appropriately, we would not be able to protect and facilitate whistleblowing, and we would not be able to innovate. And I call everyone's attention to page 20 of the report where GAO quotes a manager who said at a mental health care program at a VA facility in this country, it was the employees who were able to suggest a substance abuse program at a time of opioid crisis in this country. And it was through the union that they ensured that we had the appropriate training and perspective on this program so that it would be a success. So I want to make sure that we're understanding where we have opportunities. I think, however, we all agree on the fundamental problem here. VA is not tracking time. And I agree with everyone here that that's a problem. It needs to be fixed. It's an issue of leadership, of commitment, and accountability. But I don't want to lose what's working at the VA. And I want to do everything possible to strengthen the ability of every employee at the VA to deliver excellent care and service. And lastly, Mr. Chairman, be remiss without noting the 100-0 confirmation of the new Secretary of the VA, Dr. David Shulkin, a person who I know is committed to addressing these issues, who will ensure that we track that time, and who will make the most of the ability of those employees and the employees we have yet to hire to deliver on our commitment to this country's veterans. With that, I yield back.
I thank the gentleman from Texas. The chair recognizes the ranking member of the full committee, the gentleman, the avid runner from Minnesota, Mr. Waltz, for his opening remark.
I thank the chairman, and I just wanted to thank both subcommittees on this. I'll waive my opening statement. Let's hear from the witnesses. I appreciate the opening statements from everyone. Thank you.
I thank the gentleman, and I would like to welcome all of you. I will hold the record open for 5 legislative days for any member who would like to submit a written statement. We'll now recognize our panel of witnesses, and we're pleased to welcome Ms. Cindy Barnes, the Director of Education, Workforce, and Income Security at the U.S. Government Accountability Office. Welcome, Ms. Barnes. Ms. Kim McLeod, the Acting Executive Director of Labor Management Relations at the U.S. Department of Veterans Affairs. Welcome, Ms. McLeod. Mr. David Cox, a fellow North Carolinian, the National President of the American Federation of Government Workers. Welcome, Mr. Cox. And Mr. Trey Kovacs, the Policy Analyst at the Competitive Enterprise Institute. And pursuant to committee rules, all witnesses will be sworn in before they testify, so if you would please rise and raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth? Let the record reflect that all witnesses answer in the affirmative. You can be seated. In order to allow time for discussion, we would appreciate if you would limit your oral testimony to 5 minutes, but your entire written testimony will be made part of the record. And so we will recognize you, Ms. Barnes, for 5 minutes.
Chairman Arrington and Meadows, ranking members O'Rourke and Connolly, and members of the subcommittees. I am pleased to be here today to discuss GAO's January 2017 report on unions' use of official time and space at the VA. Federal employees, by law, are able to use official time to perform certain union activities instead of their regular work. According to the VA, almost 290,000 bargaining unit employees across the agency spent over 1 million hours on official time during fiscal year 2015. My remarks will cover 1, how VA tracks official time, 2, the amount of designated space used for union activities at selected facilities, and 3, the views of VA managers and union officials on the benefits and challenges of employees using official time. For our report, we reviewed VA's official time data for fiscal years 2014 and 2015, and this was agency-wide data. We also analyzed information on designated space at 5 VA facilities. We interviewed groups of VA managers and union officials at the 5 facilities, and we selected the facilities based on the number of bargaining unit employees and also across VA administrations. The bottom line is that we weren't able to determine the amount of official time used by VA employees and the purposes for which it was used because VA doesn't have a standard way for facilities to record and calculate official time. This situation exists because of 3 primary reasons. First, in terms of recording official time, VA uses 2 time and attendance systems across the agency that capture information on official time differently. VA's new system, the VA Time and Attendance System, or VATAS, has specific codes to record official time, but the older system doesn't. We found that 3 of the selected facilities didn't record official time in either of these systems, the old or the new one. Second, we found that VA hasn't provided consistent training and guidance on recording official time in VATAS. Timekeepers and other officials that we talked to at 3 selected facilities that had actually transitioned to the new system were not using the codes to record official time because they weren't aware of them. We recommended that VA increase its efforts to provide consistent training and guidance on recording official time in VATAS. Third, we also found that VA doesn't provide a consistent way for its facilities to calculate and report the amount of official time used agency-wide. To provide agency-wide official time data to OPM, VA uses yet another system, and this is a Labor Management Relations, or LMR system, that is separate and distinct from VA's 2 time and attendance system. VA allows its facilities to use written records, estimates, samples, surveys, or any combination of these methods to calculate the amount of official time hours used. We recommended that VA encourage facilities to rely on time and attendance records for calculating official time prior to the agency-wide implementation of VATAS. We also recommended that VA take steps to transition from using the LMR system to VATAS to collect and compile agency-wide data on official time. VA concurred with all of our recommendations. With respect to space, we found that the amount of designated space for union activities at selected facilities comprised less than 1% of the overall space available. This space was primarily office space. Finally, we found that at most selected VA facilities, VA managers and union officials we interviewed cited similar benefits of employees using official time, such as improving decision-making and resolving problems. However, they had differing views on the challenges associated with employees' use of official time, such as when and how much official time may be used. In conclusion, our work shows that VA does not have reliable information to effectively monitor and manage the amount of official time employees use for union activities. Thank you. This concludes my statement, and I would be happy to respond to any questions you may have.
Thank you, Ms. Barnes, and I want to thank you at the GAO and obviously your colleagues at GAO. You enjoy bipartisan support, even at times when I would wish you would be more partisan. I've not been able to encourage.
We feel the same way.
Yeah, no doubt. I've always found your information to be insightful and helpful, and as with your testimony here today, we do appreciate not only your testimony, but the work of the GAO as a whole. Ms. McLeod, you're recognized for 5 minutes.
Good afternoon, Chairman Arrington and Meadows, Ranking Members O'Rourke and Connolly, and distinguished members of the subcommittees. Thank you for the opportunity to discuss the progress that the Department of Veterans Affairs is making towards accounting for official time to provide the best possible service to our nation's veterans. For context purposes, the Federal Service Labor Management Relations Statute governs how executive branch agencies treat official time. The statute provides for official time for union representatives to perform certain union activities. Official time is duty time, during which a bargaining unit employee may perform representational activities in lieu of the employee's management-assigned work without loss of pay or charge to leave. The statute provides official time to negotiate collective bargaining agreements and to participate in proceedings before the Federal Labor Relations Authority. In addition, the statute requires management and its unions to negotiate amounts of official time, which the parties agree are reasonable, necessary, and in the public interest. Official time negotiations are mandatory, apply to most federal agencies, and include provisions relating to the amount, allocation, scheduling, and location of official time. VA has negotiated varying amounts of official time in both national agreements and local agreements. Many VA facilities have local official time agreements and practices specific to their location. Official time arrangements are frequently distinctively local and reflect the relationship and history between local management and local union officials. It should be noted that while management has the right to negotiate the allocation and use of official time by union representatives, in ordinary circumstances, the statute does not give management the right to select which employees serve as union representatives. As you're aware, the recent GAO report regarding VA official time use describes how VA has historically not implemented a uniform and standardized official time reporting system. As the GAO report notes, VA is now using two timekeeping systems. The legacy system, or the enhanced time and attendance system, remains in effect at some facilities. Other facilities have implemented VA's new time and attendance system, commonly referred to as VATAS, commonly referred to as VATAS. ETA does not have codes for employees and supervisors to record the local use of official time. VATAS, however, does have that capability. As of September 2016, approximately 50% of VA facilities and about one-third of VA employees, or 120,000, had transitioned to VATAS with its official time recording capabilities. The full VATAS multi-facility rollout is scheduled to be completed by July 2018. The GAO report includes 3 recommendations to improve VA's ability to accurately track employees' use of official time. VA concurs with GAO's recommendations. VA has updated and expanded timekeeper training on the collection and reporting of official time in its final ongoing VATAS nationwide rollout. Training now includes consistent guidance on the proper method of inputting official time codes into VATAS. VA is providing updated written instructions to all of its facilities seeking to establish and enforce a standardized approach to recording and reporting official time across VA. VA also intends to initiate bargaining with its national unions to come to an agreement with them on a standard approach to have union officials request, record, and report their use of official time in VATAS. VA's Office of Human Resources and Administration is preparing updated policy guidance to all VA facilities concerning the recording of local official time. For those facilities where VATAS is already operational, timekeepers and supervisors are instructed to use VATAS to record the use of official time. As VA transitions to a single, upgraded timekeeping system, official time use will become more transparent and standardized, which will guarantee accurate, timely, and reliable accounting of official time use across the agency. Relying on VATAS, VA will be able to quickly compile and report official time data to OPM, Congress, and to other government agencies, and will have a substantially enhanced ability to monitor use of official time at individual VA facilities. This concludes my testimony. I'm happy to answer any questions.
Thank you, Ms. McLeod. Mr. Cox, you're recognized for 5 minutes.
Chairman Meadows and Arrington, ranking members O'Rourke and Conley, and members of the committees, thank you for the opportunity to testify today. It would be great if this hearing were only about the findings of the GAO report on VA's record-keeping with regard to official time, but the very right of federal employees to form, join, and be represented by their unions seems to be in question. However, that question was settled 40 years ago when Congress enacted Civil Service Reform Act and stated clearly, and I quote, "Labor organizations and collective bargaining in the civil service are in the public interest." The law goes on to require federal employee unions to provide a wide range of representational services for all employees in their collective bargaining units. In order to carry out these legal obligations, the law provides for, quote, "official time in the amount the agency and the exclusive representative involved agree to be reasonable, necessary, and in the public interest." In the VA, AFG does far more than just represent and negotiate contracts. We also work hand in hand with management on a daily basis to make the agency run better by participating in many forums and initiatives, including My VA, that promote the effectiveness and efficiency of the agency by helping to improve work processes and patient safety. AFG also assists and supports whistleblowers who come forward to report instances of fraud, waste, and abuse that would not otherwise be known. The GAO report confirmed in most cases, management agrees that the involvement of the union leads to better decision-making, faster resolution of problems, and long-term improvements in labor management relationships. All of these positive outcomes provide real, substantial benefits to veterans through better care, faster claims processing, and less waste of precious VA resources. We should bear in mind that while the GAO study did find shortcomings in VA's record-keeping for official time, there was not the slightest suggestion that union officials withheld any data or information or provided inaccurate information. The findings and recommendations are all aimed at improving the training of timekeepers and standardization of data collection methods. We estimate that more than 1/3 of the VA workforce are veterans themselves, but I can tell you from personal experience that the entire VA workforce takes tremendous pride in the fact that they have been entrusted with a sacred duty of caring for and providing benefits to our veterans. It is particularly unfortunate when union representatives are blamed for VA's chronic understaffing problems. These representatives, like Kathy Dahl of Pittsburgh VA, are helping veterans by telling the truth about Legionnaire's disease. These representatives, like Dr. Michelle Washington of the Wilmington VA, are helping the veterans by telling the truth about resources for treatment of PTSD. These representatives, like Pauline DeWinter of Phoenix VA, telling the truth about how management manipulated wait lists. Many others are coming forward to tell the truth about chronic problems with the CHOICE Act, including forcing veterans to accept outside care even when they want to be seen by the VA specialists who know them best. There are roughly 45,000 unfilled positions in the VA, and reducing our ability to perform our representational duties would not even fill a small fraction of those jobs, but it would hurt the agency's ability to care for veterans. The VA's recruitment and retention problems reflect not only the inadequacy of federal pay and benefits, especially for new hires, but also the national shortage of primary care clinicians. It has nothing whatsoever to do with official time. I'll leave you with one last thought. So many try to turn official time into some type of scandal, but the fact is that official time is the antidote to scandal. It's what empowers employees to do their job more effectively and provide veterans with better care. Veterans deserve nothing less than the absolute best. Thank you, Mr. Chairman. I'd be glad to respond to any questions, and it's very nice to have someone that has a distinctive drag like I have chairing a committee.
Well, we don't need a translator, do we?
No, we don't,
The only one that has a better accent, Southern accent than I do is the gentleman to my right when he puts it on. So, Mr. Kovacs, you're recognized for 5 minutes.
Chairman Meadows and Arrington, ranking members Connolly and O'Rourke, and distinguished members of the committees. Thank you for holding this hearing and providing me the opportunity to discuss official time. Few Americans are aware that each working day, federal employees report for work but do not perform any governmental duties. Instead, they perform work for their federal employee union, a private organization that does not serve a public purpose. It serves the interests of its members. Taxpayers pay for these employees' wages, pensions, and health care benefits while they are performing union business. Taxpayers also pay for their office space, supplies, and travel. For decades, federal employees have been conducting union activities instead of delivering the public services they were hired to do. Official time is costly, not properly tracked and reported, and can disrupt the delivery of public services. The practice is a misuse of public funds because official time activity serves the private interests of federal unions, not the American people. Instead of carrying out their duties, employees use official time to lobby Congress, attend union conventions, file grievances, and perform other union activities. While taxpayers do not benefit from official time, federal unions benefit greatly. According to the latest data available from the Office of Personnel Management, official time costs taxpayers $157 million, with federal employees spending 3.4 million hours conducting union activities. However, OPM's figures are mere estimations, and inaccurate ones at that. According to a 2014 Government Accountability Office report, the methodology used by OPM to estimate the cost of official time is inaccurate. The report finds that OPM estimations have shortcomings, such as not using the actual salaries of employees who use official time. Using a more sound methodology, GAO found at 4 of the 6 agencies it examined, official time costs about 15% more or higher than OPM estimate. Besides using an unreliable methodology, OPM does not track all costs associated with official time. For example, the OPM survey does not account for the cost of travel, per diem, office space, telephones, and equipment related to official time. These costs add up. The Social Security Administration is required to calculate these non-payroll costs, which in FY 2015 amounted to $2.2 million, or about 15% of the total cost of official time at the agency. Another reason that official time costs are likely higher than reported by OPM is because reports investigating federal agencies have found not all official time activity is tracked and reported. The recent GAO report on official time at the Department of Veterans Affairs shows that the agency does not know how many official time hours are used. The inability to monitor what activity takes place on official time means it is unknown whether public resources are being used effectively. No matter the cost of official time, all federal funds need to be spent wisely and in the interest of taxpayers. When federal employees perform union activities instead of their government duties, it detracts from the efficient delivery of public services. For example, the Department of Veterans Affairs has a significant patient backlogs that could be partially remedied by putting official time employees back to work performing their regular government duties. Over 80 nurses at the VA work 100% of the time on union activities. Their time would be better spent treating patients. Official time is an unnecessary subsidy to federal unions that serves the interests of unions and their members, not the public. In conclusion, Congress should consider eliminating official time, and short of that, require detailed annual reporting of official time, to improve the tracking of federal employees' union activity performed on official time. Taxpayers have a right to know how much of their tax dollars are used to finance official time and what union activities federal employees undertake instead of the job they were hired to do. I applaud the committee's inquiry into the use of official time. Thank you, and I look forward to your questions.
Thank you, Mr. Kovacs, and thanks to each of our witnesses for your testimony. We will now begin a series of questions, and the chair will begin by recognizing Chairman Arrington for 5 minutes.
Thank you, Mr. Chairman. Let me preface by saying I know there are a lot of great Americans that work at the VA and that want to serve our veterans as badly as I do or anybody on this committee. I think the entity, I think the system, I think the bureaucracy, I think the union dynamic, the civil service dynamic has been taken way to the extreme and has been abusive and is not allowing us to perform or manage for performance so we can serve the customer, which is the veteran and the taxpayer. This question is for Ms. McLeod and Mr. Cox, and let me start with you, Mr. Cox. You mentioned the authorizing legislation or the statute that created the ability to unionize in the federal government. My reading of that says that the official time must be performed with respect to representational work. Given the access issues, given the backlog issues and challenges that we've talked about, let me back up. The other pieces of language in that legislation says that that the time spent working on official time must be reasonable, necessary, and in the public's interest. So given the challenges that we laid out in our opening statements, or at least in mine, do you believe that having somebody work 100% of their time on union activities is reasonable, necessary, and in the public's interest?
Mr. Chairman, we've got so many chairmans and ranking members today.
Right. We're good.
Okay, let's go to official time. There was a statute passed. There are those that believe that unions and official time are not important to the government and not important to the service of veterans. For employees performing official time duties as union representatives, it's not just representing in grievances or collective bargaining agreements. They serve on many committees, such as deals with the electronic medical record that the VA developed that everyone in this country is now using, patient safety issues that Dr. Beijing started many, many years ago about patient safety that's modeled after the FAA regulations that deal with how to report medical errors to prevent them from happening.
Mr.
So
Cox, let me
many
just
things that we do.
may I just interrupt just for, with all due respect? My question is not what do they do, but if they spend 100% of their time on union activities, 100% of their time, is that reasonable, necessary, and appropriate?
I would describe it that they spend their time on government activities, not union activities, because the law requires the unions to perform and to represent everyone in the bargaining unit. And so therefore, union activities that are internal to the union cannot be performed on official time.
Ms. McLeod, do you believe these are reasonable, necessary activities when somebody's spending 100% of their time and that that's in the public's interest?
Chairman Arrington, what I can tell you is that the VA has been negotiating, at least at the national level, with putting some limitations on the amount of 100% union time officials. We have negotiated with a couple of our labor partners new master agreements in the very recent years that do not have the number of 100% official time union representatives as you are now seeing. I don't know at the local level, which is where most of these 100% official time representatives come from. These are local negotiations. I wasn't sitting there, and I don't know how they determine at the local level what was reasonable, necessary, and in the public interest. But I can tell you at the national level what we're doing.
The VETAS, is that how you pronounce it? VETAS, the system for tracking? I read where that this process for creating this tracking system started in 2013, and to date, we still don't have it. It's supposed to be implemented by July of 2018. Ms. McLeod, can you explain why it's taken 5 years to put a tracking system together and roll it out?
I can't explain that. Unfortunately, that process is being managed by another aspect of the department. I can tell you that when the VETAS system initially rolled out, I think there were some issues and some hiccups, and they had to go back and re-engineer and change some things on that, and then they had to re-roll it out. But we have been adding, training components into the VETAS system for timekeepers to be able to accurately input official time records.
Thank you. I yield back, Mr. Chairman.
I thank the gentleman. The chair now recognizes Ranking Member Mr. Connolly for 5 minutes.
Thank you, Mr. Chairman. Mr. Kovacs, listening to your testimony, you seem to believe that any moment, any minute spent by anybody who is for the union, a union official, is an opportunity cost. It's lost time. Is that correct?
That is correct.
No. Well, that's a belief. That's not analysis.
And I would also...
Thank you. Ms. Barnes, I heard your testimony, and if I'm getting it right, here are your conclusions. There's inconsistent time and attendance metrics, right? They're using different systems. Not all of the time can easily be measured because of the lack of uniformity, but there are benefits to official time, correct?
Yes, we did find some benefits.
Which, of course, would counter Mr. Kovacs. You actually acknowledge there are benefits to be accrued by official time. The problem is making sure we're capturing all of that accurately. Is that correct?
That is correct.
Did you find any? Did your report conclude there was abuse of official time?
We didn't set out to even look at that.
All right, but if you stumbled upon it, you might mention it. I've worked with GAO for a long time.
Yeah, that wasn't one of our objectives, but so we didn't conclude on that at all.
Find any evidence of it?
Not in this study.
Ms. McLeod, do you all have any evidence of massive abuse or partial abuse or occasional abuse of official time?
No, sir.
I'm sorry?
No, we don't.
No. Testimony is no. Okay. So let me ask a different set of questions here, Ms. McLeod. You're going to have to speak up a little bit. So 32% of the VA's employees are veterans. Is that correct?
I believe so, yes.
So that works out to 115,000 veterans serving veterans in the VA.
Yes.
Correct. So now I understand that there are 9,000 vacancies currently at the VA. Is that correct?
I don't know the precise number.
How about you take a guess? That's about right.
Sounds about right.
All right. So let's speculate or stipulate that's correct. If you want to come back to us and say, no, it's 9,721, you can do that. And I want to enter into the record with unanimous consent, Mr. Chairman, the vacancies by state and exemption existing in the VA today.
So ordered.
Thank you, Mr. Chairman. So if there are 9,000 vacancies and about 32% are veterans currently, you could say that in theory, there are 3,000 positions that could be filled by a veteran that won't be because of a hiring freeze. Fair enough?
Sure, yes.
Okay. So we're talking about the opportunity cost of official time, but what we're not talking about is 9,000 jobs, at least 3,000 of them logically filled by a veteran, that are going to go begging. And these are for critical functions, are they not, Ms. McLeod?
Yes.
I would ask for the chart, if we've got it, to show the state chart of unfilled veterans administration jobs right now. Okay, it's a little hard to see, but for example, Georgia, 254, Maryland, 164, North Carolina, your state, Mr. Cox, and our chairman's, 343. So I guess I would just suggest that these vacancies are what we ought to be talking about. The hiring freeze and the damage the hiring freeze can do to VA and to the service of our veterans. We say we're committed to the eating into the backlog. We say we're committed to trying to streamline services and fix choice and make sure people are diagnosed in a timely fashion. And the problem isn't official time. The problem is these vacancies, and now we got on top of that a hiring freeze. It's going to make it, I think, doubly difficult to fill them. Ms. McLeod, does a hiring freeze complicate filling a vacancy?
Yes, I would think so.
You would think so. Mr. Cox, did you want to comment on that, since you've been the subject of discussion here in official time? And I kind of am bothered by the fact that we're ignoring the elephant in the room.
The VA's new secretary that I believe was confirmed unanimously the other day, which is a miracle to happen at this point in life, said there's 45,000 vacancies in the VA right now.
So I'm understating the problem.
And that would be my assumption, and I couldn't tell you if that number is the fact of what they're saying is now frozen versus they are going to fill others, but Secretary Shulkin said there's 45,000 vacancies in the VA currently.
Well, my time is up. I thank you, and I thank the panel for being here.
I thank the gentleman. Just for the record, the President has exempted 94 positions at the VA from the hiring freeze. I have a memo here from January 27th, 2017. I'd ask unanimous consent for it to be placed into the record, and without objection, so ordered. The chair is...
Mr. Chairman, I certainly do not object. Thank you for pointing that out. I was simply pointing out it's great to have 94 exceptions, but we got 9,000 vacancies, and Mr. Cox says it's even more.
Thank you. The chair is now going to recognize himself. I am fascinated by this whole discussion. I've been heavily involved in this issue on official time for quite a long while myself. It's amazing to me that we could have government employees who have been hired to do one thing and they come on board at the expense of the taxpayers only to do something else. And all too often, it's 100% of the time. I just came across in fairness, another agency, but an individual who is hired to do a particular job for 8 years now. They have not one day accomplished the job that they were hired to do, and making well north of $150,000 a year. This is, to me, just an unthinkable thing that's happening, where people are exclusively doing union activity when they were hired to do something else, day after day after day, month after month after month, and yet still being paid by the American taxpayer. Ms. McLeod, I would like to begin with you. 2012, the VA reported having 259 people who were on 100% official time. That has increased to almost 350 just in the last couple of years, from 3 years later to 2015. That's a big increase from 250 to almost 100 people, more or less, let's just round it off, 90 people increase. How does the VA account for this increase? What's behind it? What was the necessary cause?
There's likely a few things behind it, probably an increase in employees. There's probably also the reason being, term negotiations. We've had some term negotiations on some master agreements, and so that would require additional employees to be on official time to participate in those negotiations. Local bargaining or negotiating on numbers and additions to 100% official time employees.
Okay, let's move on here, because I've got a lot of questions and I want to get to, so if you could keep your answers brief and to the point, I would appreciate it. We also, during that time, obviously have had veterans who had tremendous needs, waiting in long lines. As is already mentioned, some even passed away waiting. While we've had an increase of people going to official time 100% of the time, not to mention those that are using significant amount of part-time to do official time. Does the department restrict who can go on official time? In other words, are there certain occupations, carpenters, lab technicians, or what, is there any certain group that is allowed official time or any group that is denied 100%?
The department has no control over who the union decides will have the official time for
Okay,
representation.
so anyone can. So anyone who requests it, is that how it works?
Well, those people are chosen by the unions inside the agency to perform
Okay.
that work.
All right, last year I joined Chairman Chaffetz and Meadows in sending a letter to the VA requesting official time data. And in reviewing that, I found some incredible information to me, such as there were 90 nurses who are on 100% official time. I found 3 addiction therapists, a certified respiratory therapist, 13 nursing assistants, 3 pharmacists, 6 pharmacy technicians. I even found a doctor who specializes in providing limbs to veterans who lost their limbs in the service of this country in Orlando, Florida. A specialist who, and he's giving 100% of the time. Have these individuals been replaced?
My understanding, sir, is that we backfill those positions where the individual's on 100% official time.
You backfill them with new hires?
That's correct.
So the American public is having to hire 2 people for the work of 1. I mean, this is an outrage to me to think that this is taking place. Mr. Cox mentioned that the positive outcome. I see no positive outcome in having to hire 2 people for the work of 1. Not that people doing union work don't accomplish some good, but positive outcomes? We're creating a bureaucracy that's all on the shoulders of the American taxpayer. And we're coming in here trying to convince ourselves that this is a good thing. Ms. McLeod, when you have an employee who's doing this, you were saying that you have to hire someone else to do the job that the first person was hired to do. Is that correct?
If that individual is on 100% official time and that particular occupation is necessary, the agency will backfill that position and hire someone.
Okay, Mr. Kovacs, let me come to you, and I thank you for your work in this area as well. I think you share the same concern and outrage that I share, and many of us do on this. Something else that I found stunning is that the federal employee unions can actually lobby Congress while on official time, so that they get paid by the taxpayers literally to lobby Congress. Is that accurate?
Yeah, that is correct, on desired and pending legislation.
Okay. Is that legal?
Yes, that is legal, although the Federal Labor Relations Authority has deemed it appropriate, I don't know how it squares with being necessary and in the public interest.
Mr. Cox, it's actually on y'all's website that these on official time can lobby. Is that correct?
There are certain issues that can be lobbied before Congress on official time that would deal with matters pending before Congress, such as, if you will remember, several years ago, you adopted the advanced appropriations for the VA, the only agency that gets funded 2 years in advance, while many other agencies are now talking about how great of an idea that would be. That would be an issue before Congress that many people would want to encourage and lobby for.
Mr. Kovacs, to me it's pretty clear that current law prohibits federal employees explicitly. They're prohibited from lobbying and engaging in political activity at the use of appropriated funds.
Yes, the Anti-Lobbying Act does prohibit,
Anti-Lobbying Act.
Prohibit federal employees.
So what am I missing here?
Well, so even though federal employees on official time are considered in duty status concerning pay, concerning lobbying, they're not.
And why are they not?
That's what the Federal Labor Relations Authority has decided over the years in its decisions.
Okay, my time has expired. I appreciate the others sharing indulgence. The chair now recognizes Mr. O'Rourke for 5 minutes.
Thank you, Mr. Chairman. Let me begin by thanking Ms. Barnes and the GAO for another excellent work product and helping us to make informed decisions in our jobs and the policies that we're working on and the decisions that we're making. So greatly appreciate it. And I wonder if you could begin by clarifying for me, a statement made by the chairman from North Carolina when he said that VA employees use more official time than any other government agency. The latest year for which we have reliable information is 2012, and I notice on page 1 of your report, the rate of official time at VA during fiscal year 2012 was lower compared to several other large agencies such as Treasury and Transportation. Can you explain the discrepancy between the chairman's statement and your finding on page 1? If not, I'll take it for the record. I just want to understand, and I'm sure he does as well.
Yeah, I'll submit it for the record. We only looked at VA. There was another GAO study that looked more government-wide.
Okay, thanks. And then, is it Ms. McLeod? Is that the appropriate way to say it? Ms. McLeod, thank you also for your work and your answers so far today. So my understanding, you said earlier that VA management cannot choose who it is that will serve in official time on behalf of the union and the employees that the union represents, but it can help set the percentage of time that is spent on these issues. Is that correct?
That's correct.
And you alluded to that happening on a local basis today, but perhaps the new secretary will want to standardize that across the VA.
That's correct. It has been at least the Office of Labor Management Relations direction that as we sit at the table at the national level and negotiate national level master agreements, that we've been putting some limitations on the number of 100% official time employees.
And, I share Mr. Chairman Arrington's concern about how long it has taken the VA to standardize its process to record official time. I think everyone here is deeply disappointed in that, frustrated by that. And I notice in the GAO report that VA is making a commitment to have this issue addressed, at least systematically, the IT infrastructure that you're using, by July of 2018. Is that a credible goal?
That's correct.
VA is going to hit that. You're on the record saying VA by July 2018 will have a unified system which every employee using official time will use so that we have reliable information upon which to make our decisions.
That is what we are going to endeavor to do, yes.
Okay, just to be clear on the record, you said you will try to do that, not that you will do that. I am, for the record, going to submit a request to the Secretary. I would like his response in writing, and I would be very happy to share it with the committee. We absolutely have to have the VA deliver on that. And I will tell you, reading this, it's clear to me that this has not been a priority for the VA. The VA, at the highest levels of leadership, just has not cared about this issue. Otherwise, we would have one unified system. Otherwise, we'd have reliable data today in 2017, not dependent on information that's at best 5 years old. So I want to see a real commitment in writing on paper to which we can hold you and the Secretary accountable for. So I'll be looking for that. I'd also like to say, Mr. Chairman, that I'm grateful to hear from almost every member of this committee their assurance that they are not opposed to union representation at the VA, that they see value in official time, that where we do have a problem, it is accounting for that time and understanding how it is allocated, whether it's 100% or 50%. I think those are things that we can resolve, and again, issues that can be corrected with the appropriate leadership. And I'm, again, very glad to see that we'll have Dr. Shulkin at the helm as our new secretary confirmed 100-0. Mr. Cox, finally, would you share with us, either anecdotally or through data preferably, why it might be in the public interest to have someone spend 100% of their time on official time? Why does that make sense? I think that's a really legitimate question that people we represent are asking us.
The VA is a very, very diverse organization that has lots of professions and occupations in it. The law requires for official time. There are medical center directors that have decided it would be better to have one person that's what they're doing versus to have 4 or 5 people that's taking 20% here, 20% there, 25%, because there is an orderly flow to the work that may happen, and you know that that's how you program and plan your work.
So if I could, and I'm sorry to interrupt you,
No.
just as my time expires, if I could sketch out a scenario, you have a VA director who has more demand than she has capacity, wants to maximize the workforce under her command. And so it says, instead of me working with 15 different employees, all working at varying percentages, there's one person that I'd like to go to who I can rely on 100% of the time to address issues of negotiation or training or workplace safety or other issues that are within the public interest and the interest of the veterans that we serve.
Yes.
Thank you very much. Mr. Chairman, I yield back.
I thank the gentleman. The chair now recognizes Mr. Winstrup for 5 minutes.
Thank you, Mr. Chairman. Thank you all for being here today. You know, as a physician, I'm one of the many physicians in America that had the benefit of spending some time training in a VA, and appreciate the opportunity to take care of veterans and to have that be a part of the training that I obtained. I got here 4 years ago, and this is before the situation at Phoenix broke, and I remember asking all the VHA administrators if any of them had ever been in private practice where quality and productivity were necessary elements to keep your door open, to be in the black, and none of them had, and I think that was a major deficit for our administration at that time because they don't know what they don't know. But on the subject of productivity, I would appreciate, Mr. Cox, if you could, for the record, send to me any products that the union has produced that addresses ways to increase productivity in patient care. So for the record, I would like to have that from you if there is such an item. And I do feel for hospital administrators in this situation because they're trying to provide for patients and render patient care, and that needs to be a reliable source of caregivers. And their time has to be well defined and when they are there and able to take care of patients. And that seems to be missing in this situation. And I'd like to address something, too, that Mr. Connolly brought up. And he made a point about the jobs for veterans. But let's keep in mind, these jobs exist because veterans need care. A secondary benefit would be that some people have jobs. But the first priority is that veterans need care, not because we need to create jobs for veterans. That's the primary mission. I have a question for you, Mr. Cox. Do your members pay dues?
Those that choose to join pay dues. However, there is no requirement for anyone to join or pay dues.
So you have space within the VA, and that's paid for by the taxpayer?
Yes, sir, and we're required by law to represent all employees in the bargaining unit.
I just asked you a question. The taxpayer pays for that space. Does the taxpayer pay for your copiers and everything else that you may need to have an office?
That would depend upon what the union had bargained or negotiated either nationally or
Essentially,
locally.
yes, then, because if it's bargained for, I understand, that's a legitimate answer to me, but I just want to know if that's in the agreement right now, because I don't think that's the same for other unions throughout the country in many, many situations. Let me ask you this, Mr. Cox. Does the union have a mission statement, and especially a mission statement for VA employees?
When you ask for a mission statement for VA employees, our mission statement, we support the VA also, and we're very proud of our work.
You don't officially have a mission statement? Let me ask you this. Let me ask you the priorities, because that's a yes or no. If you don't have one, you don't have one. But let me ask you the priorities that may exist. If you were to put forth a mission statement, what would be the highest priority of who you're serving, for example? Are you serving the taxpayer, the veteran, or the union? Could you list those 1, 2, 3 for me, what you think the mission statement would look like?
If you're asking for me to answer that particular question, that may be difficult. I would tell you that I believe any VA employee would tell you their first priority is to care for the veteran. And I would go back to Deputy Secretary Herschel Goldberg many years ago, that if we don't also care for the employees, we won't be able to care for the veterans. And many of the employees are veterans. And I think every employer wants to be a good work environment and to be a good employer to resolve problems in the workplace, make sure that people are treated fairly, promoted properly, and that there is a good merit system, a process. So I think they go hand in hand together, sir.
I think they certainly can go hand in hand. I just wonder if there's some analysis, if that's actually what's taking place. And maybe Mr. Kovacs, do you have some analysis of that, or have you ever looked at that and created an analysis as to what the priorities seem to be?
Well, I would say, unfortunately, as the GAO report states, we really have no reliable data of, how many hours of official time are being taken or what, exact duties are being performed. OPM, the most reliable study on it, breaks it down into 4 categories. Midterm bargaining, term bargaining, dispute resolution, general labor management. Well, 75% of official time is all used on general labor management. I'm not sure exactly what that means and what activities take place. I would assume lobbying and going to union conventions would fall into that, but I don't know what else that would entail.
Thank you very much, and I just have a few seconds. I appreciate what you're saying, Mr. Cox, from the standpoint, as a caregiver, you want an environment that can work where the person that's giving the care can render it effectively and work towards that means, but keep in mind that it's the veteran that we're there to take care of first, and that should be a priority, and when you're on the time on behalf of the veterans, that should be the priority. Thank you, and I yield back.
Thank the gentleman. The chair now recognizes Mr. Takano for 5 minutes.
Thank you, Mr. Chairman. My Republican colleagues have suggested that the 346 VA employees who use the 100% official time are standing in the way of veterans' access to care. But I would suggest if we really care about improving veterans' timely access to quality health care, wouldn't it make sense for Congress to focus our efforts on giving VA the recruiting tools it needs to fill the over 45,000 current vacant positions in the VHA? You have a response to that, Ms. McLeod? Will we not better be focusing our attention on giving you the recruiting tools that you need to fill those 45,000 vacancies?
The VA would certainly appreciate being able to fill the vacancies that we have.
Mr. Cox, do you have anything to add to that?
Certainly, I believe everyone would benefit by filling those vacancies. Number one, we would see those wait lines go down. We would see veterans properly cared for and taken care of. We would see also the employment, if it's 45,000 jobs, 30% veterans, we would see at least 15,000 veterans get jobs. So I think the benefits of filling those jobs would compound themselves over and over.
Because we're not talking about jobs created just for the sake of jobs, are we? We're talking about jobs that really are going to serve the needs of veterans, right, Ms. McLeod?
That's correct.
I read a big, this ballyhooed thing about Carrier. We're saving 1,500 jobs, but we have in Indiana. But we have 45,000 jobs that are necessary to serve our veterans. Our veterans are being hurt because those jobs are not being filled. And I understand why this administration wants to put a freeze on employing people that are absolutely needed to help our veterans. The hiring freeze, according to Comptroller General Dotterow, the hiring freeze has caused agencies to hire contractors, which was more expensive than hiring federal employees, and it didn't reduce the size of the workforce. It caused agencies problems in implementing their missions, end quote. That's what I'm scared of happening, is that this hiring freeze is going to cause us to rely on more expensive contractors, and actually we're not going to achieve any shrinkage in the number of people we need to serve our veterans. According to the VA, job applications at the VHA are down 78% since 2014. Isn't the real problem that the VA needs from Congress is more tools to recruit more qualified providers to fill these vacancies? I think we need to streamline the hiring process. President Trump issued a federal hiring freeze in January, but the VA Secretary has exempted already over 90 occupations from this freeze to protect the public safety. Most of these exempted positions are for healthcare providers in VHA. But no occupations in the VBA were exempted, leaving 763 vacancies. These vacancies could be filled by veterans or veteran families, as you mentioned, Mr. Cox. At least 1/3 of our hires at the VA are veterans. But now these vacancies will remain unfilled. These will be 763 potential employees who will not be hired to help veterans get their benefits faster. The disability claims backlog is now over 100,000 claims, and the appeals backlog is over 600,000. How will these 763 VBA vacancies hurt veterans, Ms. McLeod?
Oh, the work that those individuals would be doing won't get done, and so veterans won't have those services.
I would say that 600,000 appeals backlog, 100,000 claims in the disability backlog would imply to me that these employee the categories in the VBA should be exempted as well. That this hiring freeze was highly political and highly expedient. How does the hiring freeze make it more difficult for current VBA employees to do their jobs, thus increasing the need for official time to resolve workplace challenges and disputes? Mr. Cox.
Obviously, when people become stressed and more issues go on in the work environment, there is a greater need to resolve those disputes and to move forward. So the stress of working in VBA is very tough. My wife works for VBA, will retire the last day of this month, thankfully, but takes her job very seriously. And it is a stressful job because they understand there is a veteran at the end of that claim that deserves that claim and needs that claim, and they want to get it processed immediately, and they worry about getting it done before the veteran takes their last breath.
Well, thank you. So my time is running out, but so amid all this stress, there does need to be a better accounting for official time, but even amid, this is the environment in which VA is being asked to track official time, but official time is definitely needed in terms of the added burden and stress that we have of a workforce that is woefully understaffed. I yield back, Mr. Chairman.
Thank the gentleman. The chair now recognizes Dr. Rowe for 5 minutes.
Thank you, Mr. Chairman. I think both sides of the aisle are trying to do what is best for veterans. And Mr. Cox, I think when you were searching for what the mission statement was, I think Abraham Lincoln said it better than anybody, to care for him who shall have borne the battle. That's what our job is. And I can just tell you that the number of employees at the VA is not too little. When I got to the U.S. Congress in 2009 and was sworn in to uphold the Constitution, there were about 260,000 people who worked for the VA. Today, there are over 360,000 people who work for the VA. And I wonder, and we've gone from a budget of around $97 billion to almost $180 billion in 8 years, while the rest of the discretionary budget has stayed basically flat. We took that money away from education and to put it in veterans. And basically, I'm not interested in how many people work for the VA. I'm working for how hard and how well we fulfill that mission. And let me just share with you a frustration that I have. At a time when there are over 475,000 appointments scheduled, 30 days are out, per veteran's request, we've got critical employees like one in Los Angeles, a physician making $212,000 a year, who spends 100% of his or her time, I don't know what they are, but on official time, not seeing patients. Another whistleblower provided this information that shows that another emergency room physician at the North Chicago VA Medical Center is paid $240,000 and is currently 100% on official time. How do I explain that to a veteran when you've got a fully trained, board-certified doctor when you can't? That's one of the problems. They're backed up forever to get in. How in the world do you explain that to people? And one of your members, a primary care doctor based in Los Angeles, $212,000. That's data that we have. So we understand, and I'm not saying, we certainly understand that there can be a union. I understand that. I grew up in a union household. So I understand that. But when you have time that you're paid to be a doctor, how does that help a patient who can't see that doctor? Anybody want to take that? Got a board-certified doctor, and you have no access to them. And we're short of providers. And I can tell you, when you've hired 100,000 people like the VA has since I've been in this Congress, 8 short years, it is not for a lack of personnel and not for a lack of money. The taxpayers have provided it for our veterans.
Dr. Rowe, and I enjoyed our meeting the other day, and I think you know our commitment to the VA. I also believe all of Congress understands that a union cannot discriminate against who runs for an office and who is elected to serve in a position, be it by profession, by color, by race, by nationality. We cannot do that. The law is very, very clear that we don't get to pick those folks.
Okay, I understand that, but how do I explain it to a veteran who can't see a doctor? When you got, and guess what? It's not just the VA hospital. It's other hospitals that are short, too, of personnel. It's not just the VA. We're scrounging up nurses, RNs at our local medical center now. We're having to offer bonuses and scholarships and other things to get these positions filled. So when you have these critical positions filled and they're spending time doing completely union work, when there's a needy veteran with a medical need out there, that is the mission. It's not to take care of the union and not to take care of me if I'm a provider to VA. It's to take care of the veteran.
But I would go back to what I said earlier. To take care of the veteran, I think you do have to take care of the employee because you want a good work environment. And yes, who that person may be, the value added, that physician, that nurse, into quality management, into innovative ideas, working with the VA hand in hand. Dr. Shulkin has personally asked AFGE for a physician to serve on various task forces to help move the MyVA initiative.
We have a hospital that's right next door to our VA in Johnson City, Tennessee, that's non-unionized. They seem to function very well, and the complicated cases the VA can't handle are sent right over to the hospital that's a quarter of a mile away. So the campuses abut each other. So I don't buy that argument, and I don't buy that we don't have enough people working. There are critical shortages. Yes, I totally agree with that, where for instance, in psychiatrists and PTSD treatment, there are shortages. And I wrote the letter to the president requesting that he not freeze healthcare providers. I'm the one that wrote that letter, so I get that. But I tell you, we have some real soul searching to do in the VA right now to make it the organization it needs to be. I yield back, Mr. Chairman.
Thank the gentleman. And for the record, the VBA told the House VA Committee earlier this week that they are overstuffed at the 105% level at this point. Let's continue on. The chair recognizes Ms. Rice for 5 minutes.
Thank you, Mr. Chairman. Ms. McLeod, is there any way for you to describe what benefits having people work on official time, what benefits inure to people in a whistleblower situation?
I can tell you that we have heard, inside the agency where employees who were represented by a union went through their union to provide information about, whatever, related to wait times or patient issues or other kinds of healthcare concerns that they've had, that they did use their union representative for that purpose to give them some amount of protection to do that.
And that, in your opinion, there's no question, I think, Mr. Cox, you would probably agree with this as well. Well, I think hopefully everyone on the panel would agree that if you have a productive workplace environment where patients are being cared for, but also employees' rights are being protected, that actually will inure to the benefit of the treatment of the patients as well?
Yes.
Yes. Ms. Barnes, so with the implementation of the new IT system, do you believe that will rectify a lot of the problems that you saw in your analysis of this issue?
It's not clear, because even with the new system, there's another process that was being used at the time of our review to report the agency-wide data. So for us, we're just right now would have to wait and go back and do probably another review to look at that.
But that's a first step that you would recommend. Obviously, you're recommending, right?
Yeah, we did recommend that,
Right.
the full implementation.
Okay. Well, I was happy that Chairman Meadows, before he had to leave, was stated really unequivocally and very passionately his support for whistleblowers and whistleblower protections, which I was very happy to hear. And I just as a comment, I don't think this has to be an either-or proposition, that you have good care, but you can't take care of the employee, or you take care of the employee and you have bad care. I don't think that it has to be an either-or proposition. I think that there is a way that all of us working together can ensure that our veterans are given the treatment that they deserve, and that employees not just in the VA, but in any other organization, are respected and protected so that they can give the kind of care that our veterans need. So I don't think there's a lot of space between the sides of the aisle on that issue. And so I hope that we can transition to a conversation that recognizes the needs of protecting both as a way of enhancing the services that our veterans so richly deserve. Thank you all on the panel, and I yield back, Mr. Chairman.
I thank the gentlewoman. The chair now recognizes Mr. Jordan for 5 minutes.
Thank the chairman. Mr. Kovacs, define official time. How would you define it?
It is paid leave given to federal employees to perform union activities.
So they're not working for the taxpayer at that time, they're working for the union?
Correct.
Okay. How many folks, how many people at the VA are now on official time?
We do not know that.
Most recent reports, do you have an idea?
The OPM report doesn't cover, I believe in 2012, there was about 1 million hours of official time was used.
Okay. So the total hours just at the VA was 1 million, and that was in 2012?
Correct. And then it's also important to note, as the GAO report states, they really don't know how much official time is used.
Yeah, that's what the VA tells us.
Correct.
Okay. So let's go back to this official time. You don't know the number of people on official time?
No.
Do you know the number of people on partial time?
No.
Do you know if has there been a trend up in people on official time?
Well, I can't tell you whether there's been a trend in individual employees, but certainly official time use at the VA since 2008 to 2012 has increased greatly. It's increased from 700,000 hours to a little over 1 million in 4 years.
So in that 4 year, from 8 to 12, we saw a dramatic increase in the hours of, quote, official time. Do you have any information across government, so not just for the VA? Do you know how many people are in an official time category across the government?
Unfortunately, we don't have reliable record keeping.
What about the most recent report? Does it give a number?
No.
The number I have from OPM, I think it may be from the same report, was 3.4 million hours of official time across government, or do they say government?
Oh, that's correct. I thought you were talking about individual employees.
Oh, you're going back to the hours.
Yeah, 3.4 million hours.
Okay, but you don't have anything on the number of people
No.
across government in official time or partial time.
No.
But we do know this: 3.4 million hours in 2012 across government. And a third of that, 3.4 million hours, was at the VA alone.
Correct.
Wow. That's amazing. That's amazing. We would like to get the number. And this is, if I understand this right, that's the number that the VA gave us, that the GAO says they're not real sure they can trust.
That is correct.
Okay, so 3.4 million hours of folks working official time, which is a fancy way of saying they aren't working for the taxpayer, they're working for the union. And almost 1/3 of that 3.4 million hours is folks at the VA who aren't working for the taxpayers, and more importantly, for the veterans, but working for the union. And we don't know if we can trust that, which means it may be even higher. Is that accurate?
Yeah, that's absolutely.
And the trend between 8 and 12 was from 700,000 hours to 1 million hours in that 4-year time frame. So from 12 to 16, it's probably fair to say it's went up as well.
Correct.
We don't know, but
we don't know, and we don't have reliable.
And if VA would tell us what it is, we probably couldn't trust it.
Correct.
Wow, no wonder the veterans aren't getting the care they deserve. And no wonder the taxpayers are getting ripped off. Ms. Barnes, you disagree with anything that we just had in that little dialogue I had with Mr. Kovacs?
Well, we didn't look at the 8,012 trends, but certainly in terms of the reliability of the data, I agree with that.
Yeah, it's not real reliable. The data you're getting from the VA is what you're saying, right?
That's correct.
Okay. Mr. Chairman, this is something that's got to change. I appreciate you all having a hearing, but look, this is unbelievable. Unbelievable what we have here. So let's hope we can change it and get rid of this, all these folks on official time, which is, I love the way government works, a fancy name, official time. It sounds like they're actually working for the taxpayers, working for the veterans, when in fact it's just the opposite. So with that, I yield back.
Would the gentleman yield?
Be happy to yield to the chairman.
I mentioned earlier, we wrote a letter, and the response of the letter to the VA, to answer the gentleman's question, over 1,900 people at the VA involved in partial or full-time, 100% official time at the VA, and that's straight from the VA itself, and over 340 of which are 100%. Gentleman yields. The chair now recognizes Ms. Watson-Coleman for 5 minutes.
Thank you, Mr. Chairman. There are a lot of numbers floating around here. I'm going to try to get some clarity on some of them, but first, I ask unanimous consent to enter into the record the statement for the record from Randy Irwin, National President, National Federation of Federal Employees, to the Subcommittee on Government Operations of the House Committee on Oversight and Government Reform, dated February 16th.
Without objection, so ordered.
Thank you. I'm looking at some numbers as well. First of all, Ms. Barnes, I appreciate the information that you've given us. What I've gleaned from it is that we're not quantifying or qualifying whether or not this activity that takes place where union members are counseling, negotiating, mediating, or whatever they're doing, employees, that's not the issue here. The issue, as you have stated, had to do with whether or not we are quantifying the time, accounting for the time appropriately. And that's, okay. We're not disparaging the VA for information it is sharing. That's not what your report did. That's not the subject of this.
We took the information that the VA gave us and did some different checks and other things that we usually do to determine whether the information could be relied upon.
As you all always do. You don't rely upon any unverifiable information when you're presenting your reports to Congress. The information I have here says that we have about 360,000 employees of the VA, and less than 350 of them are 100% working in this category that we have been talking about today. Is that fairly accurate? Yes.
That's accurate.
Thank you. So that represents 1/10 of 1%. I also have some information that says that the amount of time, and this is for 2012, so the amount of time the VA employees spent on activities during official time represents just 1/500th of the total number of hours of VA bargaining union employees working. Does that sound about correct?
I haven't done the math, but
Well, my point is that it doesn't really seem to be a big daggone deal when we think about all the other challenges facing the VA and our need to present all the resources that our veterans need, because they gave up for us something and we need to be taking care of their needs. Now, I happen to have had experience in both the executive branch and the legislative branch, and I've worked with unions as a member and as a non-member in management. But I recognize the importance of employees having access to some resource to deal with guidance, to deal with problems, to mitigate problems, to de-escalate potential problems, to ensure that employees are treated fairly. And in this particular climate, where whole agencies are being gagged, where we don't know what to expect from one day to the next, from an administration that can't figure out where its loyalties lie, being able to have the kind of worker protections that unions provide is most vitally important. And so my concern would be that we ensure that there is continuity of policy and application of standards, that there is appropriate space available for these activities to occur, that there is a protection of privacy for the employee when there is this activity is taking place, but that we don't in any way, shape, or form discourage or create a cloud over this right that has already been established for employees in either the VA or any other place in government. And if we're concerned, and I believe that the function that they are providing, the job that they are doing, is very much in the best interest of both the workforce and the employer. And if I'm going to talk about whether or not people should do exactly what they've been paid for, I had to question my colleagues as to why we don't bring Kellyanne Conway in here and ask her, was she doing what she was paid for when she was huckstering the Ivanka Trump clothing line? And with that, I yield back. Thank you, Mr. Chairman.
I thank the gentlewoman. The chair recognizes the gentleman from Florida, Ms. Rutherford, for 5 minutes.
Thank you, Mr. Chairman. You know, having grown up in a law enforcement organization that had civil service protection and a union, I was always very supportive of both of those concepts. And then later when I was elected sheriff and actually became the CEO of that organization, I still supported civil service and union protection for my employees. Now, made it difficult for me to get rid of bad employees, but I always felt like everyone should have that due process, that if I followed it as an administrator, I could get rid of bad employees. And so I supported that. Now, I am a little confused when I hear some of these numbers thrown around about the official time. We had official union time as well, and we had a pool of hours that could be drawn from. So, Mr. Cox, my question to you is, under the master agreement, I see where 25,000 hours are provided for union activity. Is that correct?
You have the master agreement in front of you. Now, I'm the national president, so I'm not the president of the VA Council. I think that number is correct, but actually Ms. McLeod would probably be the better one to give you the exact figures on that.
Is that number correct, 25,000?
No, I'm not sure. It sounds correct, but I'd have to see the master
Okay,
agreement.
and then there are individual facilities that negotiate additional official time, correct?
That's correct.
And how much is that across all VA facilities? What number of authorized pool time is there, official time, as you call it? How much time is there totally available? 25,000 plus the facilities. What is that number?
So it depends on which union and which master agreement you're speaking of. If you're talking about the AFGE master agreement, the number of hours is the floor, and then they can negotiate from there locally. If you're talking about some of the more recent contracts we've negotiated, we've developed.
Okay, let me cut because my time is running out. What is the total maximum usable official time within the VA under all contracts?
I couldn't answer that.
Nobody knows that number, Mr. Cox? Surely you must know that number.
No, sir, I don't know that number.
So there's 1 million hours being used and nobody knows what the pool is? We don't know what legally is available by contract? Let me ask you this, Ms. McLeod. Are you allowed to deny any, when they, operationally, I don't know how this works within the VA. Does a union representative come to you and ask for time to perform union activity?
Certainly, at the local facilities, someone who wants to.
Okay, and so they tell you what that time is going to be utilized for, correct?
For the most part.
Okay, and you can deny that time if it's not an appropriate union activity, I presume. Is that correct?
I'm certain they could, or if they need that individual to perform other duties.
Now, can you deny them time if they go over and above the negotiated and agreed to by contract pool of official time?
That's correct, yes.
Have you ever done that?
I have not, because I don't have employees who are in the bargaining unit who work in my office.
Has any facility done that? Mr. Cox, are you aware of anyone who's been denied? It sounds to me like we grant time and nobody's even looking at the official pool.
I am sure that people have been denied official time. Again, the AFG has over 200 locals in the VA. There are other unions that represent employees in the VA. So
Thank you. Mr. Chairman, I know I'm over my time, but I'd like to request for Mr. Cox, if you could send me in writing what the total official pool time or official time pool is for VA master agreements and facility agreements. What is the total amount of time?
Sir, I can tell you now, I can't tell you that time.
Who can?
The VA would be the one that would have the
Ms.
ability to
McLeod,
tell you that.
then you can provide that?
We will provide that.
Thank you, I'll be glad to get it.
Would the
Thank-
gentleman
thank you,
yield?
Mr. Chairman.
Would the gentleman yield?
Yes.
Mr. Cox, you said that there have been people denied official time. Could you provide a list of who that would be?
I can only tell you anecdotal information because, yes, people are told, we can't spare you that day, or it's not a convenient time.
So you can't
could
provide
go
a
later
list,
on.
you
No,
just-
sir, I can't provide that list, but yes, that does happen, sir.
The gentleman yields back to the gentleman from Florida, and the gentleman from Florida's time has expired. The chair recognizes himself for a series of questions, but I'll yield to the gentleman from Ohio for a brief comment. Mr. Winster.
Thank you, Mr. Chairman. I just want to make one thing clear, too, in this dialogue. We have phenomenal caregivers in the VA system. We really do. I get very few complaints about caregivers. The system complaints often. I will be the first to protect whistleblowers. They have come to me with some valuable information and insights. And I believe in a due process for people. And I also believe we want to create a non-hostile environment for people to work. But I just want to make sure that we're not unnecessarily taking away from valuable time and assets for taking care of our veterans. And with that, I yield back.
I thank the gentleman. I thank each of you for your testimony. My apologies for having to step out. It's sometimes you have a number of issues that are going on simultaneously. Ms. McLeod, let me come to you, because what the GAO reported is that what the VA has could only be described as dysfunctional at best and non-existent at the worst in terms of being able to track this. I mean, they can't even get an accurate count of official time. What is the VA doing to correct that?
Well, the VA is implementing across the system the VATAS, which is the VA Time and Attendance System. That system has been improved so that we can appropriately track the use of official time. It has the categories.
So when will it be
requires
implemented?
Fully by July 2018.
Okay, and why is it taking so long to do that? I mean, I can hire a private sector to get something done in half the time. Why is it taking so long?
I don't know, sir. I just, it's not a program that my office is responsible for. I'm just not sure.
So who is responsible for it?
The Office of Management is the office that is rolling that time and attendance system out.
So how do you know for a fact that it'll be implemented by the 18th?
They
I
have,
mean, if you're not implementing it, how do you know?
they have assured our office that it will be fully implemented, and that's,
All right, so how do you figure out if somebody's using 100% of the time, how do they account for their time?
they should be accounting for it at the local level. I mean, it's incumbent upon.
They
local
should be, I agree. I mean, we agree on that. Are they?
It is our belief that they are. They are reporting up to our office every
Okay.
year of the amount.
So your sworn testimony, it is your belief that they are. So why does GAO have such a hard time figuring out the numbers? And this is not a new problem, Ms. McLeod, is it?
No, it's not.
And so why are we still here talking about it? Because Mr. Ross was here earlier, and when I was doing my research for all of this, it looked like it was a problem in 2012 when he and Phil Gingrey was looking at this. Was it not?
I'm not sure about that.
In 2012, was it a problem?
I'm not sure. I suppose it could have been. I don't know that for sure.
Well, who does know? You brought staff behind you. Do they know?
I don't know that they know. I can tell you.
So are
that-
they on official time?
No, sir.
Okay. So you brought staff that can't answer the question.
I can tell you that there was a report that GAO did in 2014, and in 2014, there were issues with our ability to consistently and accurately track official time. We weren't, however, the only, government agency who experienced those concerns, and we've been moving, I believe, in the right direction with the implementation of ATAP.
Moving in the right direction over a 4-year period, if you're acknowledging 2014, over a 4-year period, how long does it take to figure out if somebody shows up for work and what they're doing. I mean, in the private sector, it takes me literally a very short period of time to do that. And even with the volume of employees that we have in the VA system, why can you not do that?
They're doing it on the local level, as far as we know. They're reporting that
Well,
information up to
it's
us.
sworn to, here's what I would like you to do, is for every one of your VA facilities, if they're doing it on a local level, they need to report back to this committee on how they're keeping track of it. Because what I understand, they're taking surveys. Is that correct?
I believe that's one of the methods that they're using.
So we're saying, fill out a survey on how much you may have spent on official time? Do you think that that's an accurate way, Ms. McLeod, to look at it?
It's not the most accurate way. no.
Mr. Cox, how would you say do this?
I don't know that I have an answer on how to do it, sir, because, again, the VA's computer systems and all are very, very complicated.
So you're saying that this is a computer system problem?
Well, it may or may not be.
Okay, well, let me just tell you.
I won't identify that. The VA is a very complex organization.
So if I get you the computer system, of which tracking time and attendance we can probably do on the capability on an iPhone now, so are you willing to make sure that all your covered employees accurately report time to the VA in terms of official use?
I believe that our employees, our members, are reporting their time. I believe the GAO study showed very clearly that
That's not the question I asked, Mr. Cox. Now, we don't have a problem of communication because we don't need an interpreter. The question I ask is if I give you the ability, will you require all your members to properly document where they're spending their time?
I think our members already do that, sir.
100% of them? Is that your sworn testimony?
They report to their managers. They certainly do, sir.
I didn't say that the reporting time and reporting to a manager are two different things. So let me ask you this. Is picketing part of official time?
No, sir, it is not.
Okay? So you know in North Carolina that you had a president of a local, of a part of your union that was out picketing, and she's 100% official time at 11 o'clock on a Thursday.
Did you check her record to see if she possibly took
Well,
annual
she didn't
leave?
have a record, because, yeah, she could have had leave.
Because frequently our members, if they do those type activities, take annual
Do
leave.
they always do that?
They are supposed to, and we train them and we tell them that, sir.
All right, and so you're saying that she was actually on annual leave when she was picketing?
I can't speak for that individual because I do not know her time and attendance. I can tell you the instructions AFGE gives is that those type
Do you
activities.
see why we have a
you should-
problem with oversight, though, Mr. Cox?
Yes, sir, I do,
And
and
do you see why we need to have a proper, because here's the thing is, I will defend your right to be able to use official time. But what I will not defend is people being on it 100% of the time. When was the last time your contract was negotiated, Mr. Cox?
The contract with the VA was negotiated probably, it was signed maybe about 3 or 4 years ago.
2011. I knew the answer. I was just waiting for you.
2011.
All right,
Because
so-
actually, sir, and if you're aware of the fact, AFG is a very large organization. I do not personally negotiate all those.
But this is not your first rodeo. You've been
No, sir, it's not
reelected.
my first rodeo.
And
I
so,
can't-
what I'm saying is that if you do not have, do you have a current contract, or are you
I'm sure in
operating-
our office that we have it, but.
Are you operating under the 2011 terms?
If you're telling me that, I'm sure that we are, sir, because I delegate those responsibilities down to councils that operate.
Ms.
inside
McLeod,
of
are they
AFG.
operating under 2011 terms?
Yes.
All right. So let me ask you this, Mr. Cox. Assuming that 100% of this official time is used for negotiations, is that what part of official time would be used for? Grievances?
It would be part of it. I would say in the VA, sir, a lot of official time is spent in quality management, improving work processes.
All right, well, I was afraid you were going to go there, Mr. Cox, and so let's take Salisbury. You got more people there in Salisbury on 100% time, and yet we've had a backlog. So the quality of care in Salisbury pales in comparison to Charles George VA in my district. As you know, Charles Jordan, I'm a huge fan of the VA. Ms. Brayfogle does a great job. And let me tell you, all those employees at the VA, they are doing a great job. But the problem is, official time, they don't have anybody on 100%. And Salisbury, who has a real problem with backlog, has 6 people on 100%. Can you explain how they are focused on quality at Salisbury with official time? There is no correlation, Mr. Cox.
Sir, I would say part of those questions would be more appropriately directed to the director of the medical center at Salisbury.
Well, no, you just went with your sworn testimony, Mr.
Yes,
Cox,
sir.
and you said that all this official time is to drive quality. That's what you just told me.
We do a lot of quality work.
How much of it?
I can't give you answers on all of that, sir. and you know
Why
that I
can't you give me an answer?
Because the VA is a very large organization.
Okay, Mr. Cox, you have now come to the crux of the matter, and so let me be blunt. The time for proper accounting is now. And so my charge to you, Ms. McLeod, and to you, Mr. Cox, is what we're going to do is start to look at some direct correlations. There is no direct correlation in terms of the amount of official time with regards to grievances or quality. I can't find any linear correlation there. So until you can show me that official time can be directly correlated to the quality of health care that our veterans deserve, we've got to reform it. Wouldn't you agree with that, Mr. Cox? That if they're spending time and it's not actually producing results, we need to change it.
I think that you're trying to maybe phrase a question to get an answer from me, Mr. Chairman, that I'm probably not going to answer for you. I believe clearly—
Well, you have to answer. So, I mean, you may not answer it the way I want you to, but
all right.
your sworn testimony—
And I am giving you an answer, sir. Certainly, I believe official time contributes to the quality of care of the veterans at the VA.
Okay,
Now,
here's
you're
what I'm
looking
asking you to do.
You're looking for anecdotal things.
No, I'm
I have
asking you
promised
for
to—
qualitative data. I don't care about
and
the
we are
story.
glad to work with the VA, and I have done that with the VA over and over again. I met with the chair of the VA committee the other day, and we will work continuously to improve the care of veterans.
All
at
right,
the
so
VA.
here's my request of you. My request of you is I need a direct correlation between the amount of official time and a direct result in terms of training and quality. How long will it take you to get me that kind of direct correlation from your members?
I can't give you an answer today.
What's
but
a
we
reasonable
certainly-
time?
I will get back with you.
60 days.
I will give you I will be glad to respond and to give you an answer, sir. May not be the answer you want, but I will give you an answer, sir.
So your response is you're willing to give me a direct correlation between official time and the results of that official time in 60 days?
I am certainly telling you I will give you an answer, sir.
Well, that's not an answer to my question. But you're going to have to, you can pick the time frame, but you're going to have to give me a response to
and
that.
before I can give you an answer on the time frame, I certainly would need to consult. There's over 200 locals and probably 250,000 people that AFG represent.
All right, so here's my charge to you is in 60 days, either you get me that or you get a very detailed explanation on why you can't get me that. Ms. McLeod, are you willing to do that as well?
Yes.
All right, thank you both. I'm going to go ahead and recognize Mr. O'Rourke for his closing statement at this point.
Thank you, Mr. Chairman, and thank you again for holding this hearing. And I got to tell you, while we may not agree on all our conclusions about the issues at hand, I think we share a common interest and goal in ensuring that every veteran is served and treated with the utmost dignity and respect, gets the greatest quality of care, and the best outcomes. And I also share your frustrations. It's inexplicable that we have gone this long without reliable data on how official time has been measured and how it has been used. It prevents us from being able to answer your question about determining the value categorically of that official time. I've also heard you and other members from both sides say that they are not opposed to public sector unions or the representation by those unions of employees at the VA, and that they are not inherently opposed to official time. And I'm encouraged by that because this GAO report shows from both VA employees and by the management that are directing those employees and are fulfilling our most sacred commitments, that they see value in this. And there are anecdotes pointed out, whether it's improved scheduling for nurses or, as we mentioned earlier, including substance abuse counseling in our mental health care treatment regimens for veterans who desperately need that, ensuring that our VA medical centers are operating more effectively and efficiently, resolving disputes between management and personnel in a more efficient manner so that it doesn't drag on and doesn't prevent the effective delivery of care to our veterans. Those are all things that I would point to that I know official time proves its value in. And I'd also say that it's U.S. law going back to the Kennedy administration, reaffirmed in Nixon, and every successive Congress and administration since then, that we find public value in this. Why do I say this? Because some folks today have talked about official time as though it's some shameful act that we must hide or cover up for or apologize for using more than a certain percentage of our time to complete. If we agree, and this is a good question for all of us to resolve for ourselves, for our constituents, and for the country, if we agree official time has value, then we can move on to the other questions about how we measure that value, how we measure the amount of time spent on official time, and what it does in the delivery of governmental services, in this case, care for veterans. If we don't believe in the value of official time, if we think it's a scam and a fraud, well, then that's a decision that we can make as well. I happen to think, as has almost every Congress and government of the United States since the Kennedy administration, that there's real value in this, in delivering the care that veterans depend on from the VA, whether it's the National Cemeteries Administration, the Veterans Benefits Administration, or the Veterans Health Administration. We just need to do a better job of measuring that. When you were out of the room, I asked Ms. McLeod to commit to delivering on the VA time accounting system for official time by July 2018, as is mentioned in the GAO report. She's unable to do that on the record today, so I'm going to ask in writing from the Secretary himself to provide that. I'll share his answer to the committee, because I agree with your frustration that we're not going to be able to get the answers to these questions without accounting for that time. I'll also add for the record that every recommendation made by the GAO in this excellent report was accepted by the VA, and we're going to hold them accountable. That's our job, and we need to do it. Lastly, I'll end where I began the hearing today. Very encouraged in President Trump's nomination and the Senate's confirmation of Dr. David Shulkin as our VA Secretary. I know that so much of what we want to see rests on his shoulders. I know he's capable of doing this. With our assistance and oversight, I fully believe that he will, and I look forward to working with you to make sure that we get this done. So thank you for holding the hearing today.
I thank the gentleman from Texas. The chair recognizes the chairman of the subcommittee, the gentleman from Texas, Mr. Arrington.
Thank you, Mr. Chairman, and I appreciate my subcommittee ranking member's request for a commitment on delivering the tracking system on the designated time. There is the law, and there's what's right, and not always the same. And I had a B-Law professor at Texas Tech that used to talk about, we all have an ain't right meter in everybody. And I can tell you, at least in West Texas, but I bet 99% of the people in this room, when we discuss these issues of not being able to track the time and allowing a taxpayer-funded federal employee to spend 100% of their time on union activities, I bet your ain't right meter is pegged just like mine. It's just not right, especially with the context of all the challenges to meet the needs of our veterans. I had a lady last night introduce me. I was surprised that she introduced me and bragged on my time, or my appointment rather, on the committee, and she cried and she said, please, please make sure that we are served well. And I just can't in good conscience tell her in this case that she is. According to the AFGE, Mr. Cox, representational work includes, quote, flexible work hours, developing telework practices, and providing workers with a voice in determining working conditions. While I appreciate the need for that, where's the voice for the veteran? Where's the voice for the veteran in determining the conditions under which they receive excellent service and care? Where's the voice in your process for the taxpayer to sit at the table and say, this ain't right? To have 100% of somebody's time spent on union activities when hard-working, middle-class, working-class folks from West Texas are paying the freight. Thank you for your time. Thank you for your insights, and thank you, Mr. Chairman. I yield back.
I thank the gentleman from Texas. I want to thank all of you. I want to remind you, as many of the members have said, that they've asked questions for the record that need for you to get back to them on, and so you have 2 weeks to respond to this particular committee for supplying answers to those questions, and so I would like to mention that. Let me close by saying this. Mr. O'Rourke and I agree that there is, the official time certainly is of benefit and has its useful tool. But just like with anything, when used in excess, it does become abusive and at the expense of something else. And so, Mr. Cox, let me be very clear. When I'm looking at the quality of health care for the veterans served out of Salisbury versus the quality of care of the veterans served out of Charles George, and the amount of official time that's spent in Salisbury versus the amount of official time that's spent in my district, there is no correlation. In fact, Charles George is one of the best, if not the best, VA hospital in the system. And so to suggest to this committee that 100% official time is somehow providing a result in Salisbury, North Carolina, that's superior to Asheville, North Carolina, does not correspond to your argument here today. So here's what I'm going to do, Ms. McLeod, and you need to make sure that we look at this. I'm looking forward to both of your responses. But we're going to go from this committee to some of the facilities. And we're going to ask the hard questions about the official use and how much training and quality support has actually been there. Because we can't afford to get this wrong. And quite frankly, we've been getting it wrong for far too long. And so today is a somber moment in terms of what you want to argue about in terms of official time, but it really comes down to one thing. We have a responsibility to serve our veterans, and any abuse of a system is not only not tolerated, but is going to be looked at in such a finite way that we will correct it. And I look forward to your recommendations on how we correct it, Mr. Cox, and how we make sure that it's fair and equitable. Because I'm sure that you're not suggesting here that we don't serve our veterans properly. Is that correct? Well, I've got a lot of veterans who would disagree with you, Mr. Cox. And so with that, I want to thank you all for being here for your testimony. And if there is no further business before the subcommittees, they stand adjourned.